Magnetic resonance imaging, or MRI, is a non-invasive imaging technology that creates detailed images of the internal structures of the body. The technique is based on the principles of nuclear magnetic resonance, exploiting the magnetic properties of atoms, particularly hydrogen, which is abundant in the human body due to its high water and fat content. The process involves the use of a powerful magnetic field, radiofrequency energy, and sophisticated computing to generate images without the use of ionizing radiation. At the core of MRI is the behavior of hydrogen atoms, which contain a single proton. These protons spin, creating a small magnetic moment, making them behave like tiny bar magnets. Normally, the magnetic moments of these protons are randomly oriented, cancelling each other out. When a person is placed inside an MRI scanner, which houses a strong magnet, these protons align with the direction of the magnetic field. Some protons align parallel to the field, low energy state, while a smaller number align antiparallel, high energy state. The net result is a slight excess of protons in the low energy state, creating a small net magnetic effect in the body. The MRI machine then emits a burst of radio frequency, RF, energy at a specific frequency, known as the Larmor frequency, which is determined by the strength of the magnetic field and the properties of hydrogen. This RF pulse excites the protons, causing them to absorb energy and flip away from their alignment with the magnetic field. Simultaneously, the protons begin to precess, or wobble, around the magnetic field's axis, moving in sync with each other. This state is temporary and ends when the RF pulse is switched off. Once the RF pulse ceases, the protons start to relax, releasing the absorbed energy as they return to their original alignment with the magnetic field. This relaxation occurs in two distinct ways. The first is called longitudinal relaxation, or T1 relaxation, where the protons realign with the magnetic field. The rate of T1 relaxation varies depending on the type of tissue, providing contrast in the MRI images. The second process is transverse relaxation, or T2 relaxation, where the synchronized precession of protons in the transverse plane, perpendicular to the magnetic field, starts to decay as protons dephase due to local magnetic field inhomogeneities. This also occurs at different rates in various tissues, further enhancing the image contrast. As the protons relax, they emit weak radio signals that are detected by the MRI scanner's receiver coils. These signals are processed by advanced computer algorithms to construct detailed images of the body's internal structures. The contrast in the images is influenced by differences in T1 and T2 relaxation times, as well as the density of hydrogen atoms in different tissues. For example, tissues with high water content, like cerebrospinal fluid, appear differently from those with less water, such as bone or fat. The MRI system also uses gradients in the magnetic field to encode spatial information. By varying the magnetic field strength across the scanning area, the machine can determine the location of the signals emitted by the protons. This process, combined with the ability to adjust the RF pulses and relaxation measurement parameters, allows the scanner to produce images in different planes and provide various types of contrast, tailored to highlight specific tissues or abnormalities. The resulting images from an MRI scan are highly detailed, enabling the visualization of soft tissues, organs, and even subtle differences in tissue composition. This makes MRI an invaluable tool in diagnosing a wide range of conditions, from brain and spinal cord disorders to joint injuries and cancer. Unlike X-rays or CT scans, MRI does not use ionizing radiation, making it a safer option for many patients, particularly for repeated imaging. However, the strong magnetic field necessitates careful consideration of metallic implants or devices within the body, as these can interact with the magnet. MRI represents the culmination of decades of research into physics, engineering, and medicine. Its ability to produce high-resolution, multi-dimensional images has revolutionized the field of diagnostic imaging, offering insights into the human body with unparalleled clarity and precision. Despite its complexity, MRI has become a routine part of medical practice, providing critical information to guide treatment and improve patient outcomes. Thank you for watching. We have some amazing videos coming up, so stay tuned and make sure to hit the subscribe button.